Hi, I'm Dr. Amber. I'm a small animal rehabilitation vet and I specialized in advanced aging and geriatric pet care. And today I wanted to talk about another thing that I hear frequently, which is, did I miss something or did I cause this to happen? And this one is an emotionally loaded question, right? Because we often feel like we have more control over our pets' destiny, our pet's biology, our pet's future because we love them and they are part of our family and they're our soulmates and they're our companions through a lot of difficult times. And the reality of most things is we don't have control of a lot of stuff, right? I mean, genetics, heredity, breeding lines, there's a lot of reasons we can get different injuries, illnesses, and conditions. And it is really unrealistic to feel like we can change biology in our pet, especially if we don't know that it's a predisposition, to make it not happen, right? So one of the big things, especially hereditary conditions, once we find them, we can manage them, right? So if we find them when they're puppies, you have young dog hip dysplasia, we can manage that over time. But there is no way to predict which dogs will get heart disease or cancer or certain neurologic diseases as they age. Now, there are some magic tools, right? Like genetic testing. Certain breeds do have genetic markers. So I can test young dogs for like degenerative myelopathy, which is a progressive neurologic condition that can come on and be very devastating when you find it end stage. But if you test your puppy, if you have certain breeds, which there are a lot of breeds that can get that condition, that the first sign of any hind end weakness, we can start therapies and treatments and manage that condition the best we can. We cannot realistically prevent our dogs or cats from getting cancer. We cannot necessarily prevent them from getting liver disease or kidney disease. So one of those things, when I find like a giant liver tumor in a 15-and-a-half-year-old large breed dog, it is devastating and it's still scary. It doesn't matter that they're geriatric. It doesn't matter that you had no idea, right? It's almost more of an insult. What could I have done to either find it earlier or catch it? And there are certain things you can do to look for cancers in diseases. We can do twice a year blood panels, right? Look at liver function, look at kidney function, look at electrolytes, look at CBCs, which can give us some indications, but most things nebulous or insidious like cancers don't show up on blood work. Even if you do the screening blood test for some cancers now, it doesn't detect all of them. And the other thing you can do is routine x-rays and ultrasounds, right? So we can take x-rays of the chest and abdomen and look for changes in organ size, look for evidence of changes to our heart size, look for things that are indicators that there's something else going on we haven't found yet. An ultrasound is a 3D view of what's going on in the belly or in the heart. But we can't prevent everything. My own dog, he had full x-rays, blood work. He was completely clear of everything. And then he started to breathe a little funny and I kind of ignored it because I just had fresh x-rays, fresh blood work, and he was a 14-and-a-half-year-old Chihuahua. And when I repeated his x-rays, and it was almost 2.5, 3 months from the original set, he did have an insidious kind of cancer called hemangiosarcoma. And that kind of cancer, because it's a blood vessel based tumor, can grow quickly, can spread quickly, and you can get sick and leave quickly because of the nature of that disease. So the biggest things I think that we have to have a really big concept of is there's this illusion of control. We feel like we have control over our pet's destiny, where really we are guiding and shepherding them through life the best we can. And another person told me one time, this internal medicine specialist, that age just allows you to get more odds of getting a different disease. So sometimes it is the double-edged sword. You live to 15, it's magical, but then also it increases your chance of having something that can be life-affecting. So especially my pets over 12, I typically recommend twice a year blood work, once a year x-rays to screen for big things, or if there's any sudden acute changes, then x-rays and blood work to make sure we're not missing something. So again, these are questions you can ask your vet, what your routine screening would be for their senior or geriatric pets, even your young dogs. We can get cancer in young dogs too. but you guys are doing great as pet parents. We are unrealistically hard on ourselves. And I think most people should realize that we provide loving households. We provide care that these pets would not get if it was not with us. And we help keep our pets alive for a really long time. So you should be proud of the quality of a pet parent you are and not so hard on yourself. Have a great day.